there are loads of different treatments that you'll learn about in your study of A-level psychology to deal with a range of conditions like schizophrenia, depression, phobias, and OCD. But how do we evaluate them? Well, this is Galbraith Does Psych, and we're here today to talk about this very thing in this Skills for Psychology series. Now, if you're new to this channel, I teach AQA A-level psychology, but what we're going to talk about is very much applicable to a range of exam boards and situations. I just want to point out at this point that if you haven't looked at the AQA specification and you study AQA, you'll find in the paper 3 material reference to effectiveness and appropriateness. You need to be able to, when you're evaluating treatments, refer to how effective they are and how appropriate they are. So these are two key pillars of the way in which I teach my students to evaluate therapies in psychology. There are other properties, other qualities that I do talk about, such as how accessible they are, how economical they are, and how ethical they are. And we'll get to those later on. But your absolute key ones to focus on for paper 3 we're talking about are effectiveness and appropriateness. But it makes sense to me that, okay, they're for paper 3, but we learn about therapies in year 1 for paper 1 as well. So why not apply that to paper 1? That gives you ideas and it gets you in the habit of doing it for year 13. So let's crack on. We're going to look at this today in the context of depression. It could easily be any other condition. We could do it for schizophrenia, but not everybody learns that option. So let's just use something that everyone does. Let's look at CBT for depression. So effectiveness, what we're looking at is, does research support the fact that CBT actually works for depression? And yes, it does. So what might that look like? Well, one strength of CBT for depression is that it's supported by research. There's a nice clear point signposting to the examiner that I am evaluating it. For example, a review by Kuipers et al. Found that a CBT group improved significantly more than a control group receiving no treatment. There's my evidence. Where's my conclusion to this? Well, this suggests that CBT is an effective therapy for depression. It's simple, it's to the point, it's not necessarily A-star quality, but what we're doing today is we're talking about the themes of how we evaluate a therapy. In reality, I'd want to be kind of counterpointing, counter-arguing, reconcluding, and all of that jazz. Okay, appropriateness. How appropriate is CBT? Well, actually, this isn't quite so good because one limitation of CBT for depression is that it does not work for everyone. We know that, it's not 100% effectiveness, but there are certain situations where it's less appropriate. Here we go. So, for example, Elkin et al. Argue that it's not suitable for people with highly rigid, irrational beliefs. Yeah, so these people that have these beliefs that are very resistant to persuasion, very resistant to that, remember that disputing element of CBT. Also, we know, think about it, CBT requires a significant investment in terms of, lots of thinking, lots of talking, lots of reflection and emotional investment. That's not possible for everybody, and some people just aren't willing to engage with that. So where's the conclusion? Well, this means CBT is limited in terms of its appropriateness as a therapy for depression. So I hope you can see kind of how the effectiveness and the appropriateness work. You can do this with any therapy for any condition. So I would encourage you to try this sort of thing with, like I said, OCD, phobias, schizophrenia, whatever you're learning about, whatever it might be. Other options, addiction, all those sorts of things. Okay. The other 3 that I mentioned, and these aren't absolutely crucial, but they will give you ideas when you're evaluating a therapy. Okay. And the reason that I like as well to talk about themes as opposed to just learning different evaluation for every different lesson is that it gives you, we're building schemas, aren't we? We're building a schema of how we evaluate, in this case, therapies. And therefore, you know what to expect when you get to a new topic or a new lesson. So these are the themes that I try to apply when I'm evaluating a therapy. And when we come to comparison of therapies, and I'm sure I'll do a video at some point on comparison, when we come to comparison, it gives you things to talk about. Anyway, accessibility. So Is it available for everybody? Is it something that can, be inclusive to a range of people? Well, yes, it can. There are issues with it, but again, we're just going to focus on writing about accessibility. As I said, you'll probably want to do a counter argument at some point. But a strength of it is that you can do it in lots of different ways. Yeah, you can tailor it. It can be online. It can be solo sessions, group sessions. People can do it by themselves and just kind of have telephone check-ins or workbooks to work through. There are lots of different ways to run CBT, and you can tailor it therefore to a range of people in a range of circumstances. This means that CBT is an inclusive and accessible therapy for depression. There you go. Not too many frills there. As I said, we're focusing on these themes today. Economics. Is it expensive? Think about the short-term and long-term cost here, and this could be a nice chunky discussion, but again, we'll keep it straightforward enough for the purposes of this video. So yes, it's good. It's got a good long-term impact. It can be expensive, CBT, in the short term, but after a while, it might take a month, it might take 6 months, it might take a year, but you'll get to a point with the vast majority of patients where they have enough in terms of strategies to manage the symptoms themselves. So this is a strength. It's long-term impact. For example, patients are taught, as I said, coping strategies. It allows them to manage their own symptoms. Despite the short-term cost, this means that CBT may pay for itself in the long run, reducing burden on the NHS, and that's a really good thing to link into your evaluation and discussion. That impact of psychology on the economy. This demonstrates CBT is an economic option for treating depression. Finally, ethics. So this is quite good from a CBT ethics point of view. Well, one strength of CBT is that it actually involves the patient. Think about drug therapies. Okay, there'll be a conversation with the GP, for example, about what drugs there are and what the GP thinks might be best. But CBT actively, every session is involving the patient. For example, therapists offer empathy. Remember that unconditional positive regard that they're trying to give the patient. They're trying to give the patient a voice in their own treatment. Patients are directing a lot of what happens in these sessions. And this means that CBT empowers the patient, in contrast to something like drug therapies. Yeah? Often you won't even see the word patient. You might see them described as clients, which itself is quite a humanistic, empowering thing to be doing. Okay, therefore, CBT is arguably an ethical and positive option for patients to manage depression. And there you go, even in that wording at the end there, to manage their depression, as opposed to, a treatment, a kind of medicalization of it. Yeah. Okay, right, so we've talked about evaluating therapies in terms of their effectiveness, their appropriateness, and we've gone on to discuss themes like accessibility, economics, and ethics. I hope that you found that useful and interesting. Feel free to press some buttons, leave me a comment, tell me what you think about it, ask me a question, get involved. Thanks very much, everybody. There you go. See you again in another video. Bish bash bosh.